Hi everyone, this is Shinan from Center of Balance, the acupuncturist. Today I'm going to show you how to use acupressure point for hip pain. How to do acupressure point for instant relief for hip pain. Okay. Now, if you watch this video, I would like you to do something for me to help my video. To get more people to watch this video. So I'm actually doing a live video every Friday. Okay, this is free, and I'm hoping that this video can help more and more people to get some pain relief. And today's topic is about hip pain. All right. I would like you to like this video and share this video to your family, your friends. Okay. Share it on your Facebook page, and that would help people to realize that, notify that we are here to do the live video. Alright, let's get into the topic today. So let's have a look where is hip. Okay, so I'm going to show you something here. So you can see it here. This is hip. Okay, the hip joint. The hip joint. This is the hip joint, alright? So, what a hip joint putting in here, that is the what we call groin as well. So, but today we're going to just focus on the pain over here. So, which is the pain by using this one. The pain over here. Okay. So hip pain, so people will say this is hip pain, this is hip pain, but the hip is actually in here. So how do you locate the point? Where actually you locate it? So this is my hip. Because there's a lot of muscle in here, so sometimes it's a bit difficult to locate to the hip joint. So this is how you get into it. So use your palm to press it. Okay, this is soft in here, and we go down here. This is harder. When you hit the harder part, which means you hit the joint, the bone in here. Okay, if you do it up here, you feel bony as well. Like this is in here. Okay, this is not the hip. How do you know when you hit in here? This is hard, and this is soft. Alright, and lower here is hard too. It's harder. It's bone. So you move your leg, and you can feel it's moving. Whatever here, the hip joint is moving, and you know this is the hip joint. And when you hit it in here, it's not moving underneath, and the bony end over here is not moving. So this is not a hip. Okay, this is how you can tell where the hip joint is. Right, the hip pain. Now, according to Chinese medicine theory, right, we lock on the meridian. Okay, this is we call gallbladder meridian. Okay, in Chinese medicine we call foot Shao Yang. Shao Yang is the family name. So Shao Yang. Hi, Namika. Good morning. Thank you. This is Shao Yang, okay, and this is Tai Yang, which is bladder meridian. All right. So when we treat here by using acupressure point, we don't press it. In this method, we don't press it in here. We don't press it in here, right? Because you get two kind of results. If you know how to press it and massage in here, you get relief. But some people, when they press it over here, they either press it too hard or they didn't do it right. You make it worse. They make it worse. Okay. So what happened in here today? I'm going to show you some distal point. So all my video, live video, I'm going to show you distal point, which means you won't make it worse. You wouldn't make it worse. Okay. You will only make it better. This is my intention. I'm going to show you something that will only make it better it won't make it worse. Okay, so you're not gonna massage in here in my method. So this method called distal acupuncture. So we turn it to acupressure, so distal acupressure point. All right. So if you have a look on here, this is a theory about it. So there's a person here. This is the leg. This is the leg, right? If this person has got leg and he have hands, right? And now he need to use hand to do everything, right? And you need to use hand to walk. So hand can be leg, right? Now if that hasn't got legs, hand is his leg, okay? So we have a look on here. This is the foot, this is knee, and this is hip. So shoulder can be hip. Shoulder can treat hip. Right. I'm just explaining the theory about it. So if the pain is over here on the side, you treat here. This meridian is Sao Yang, called triple burner, and this meridian over here, you see over here, is called small intestine, which is Tai Yang. So over here, if the pain over here is Tai Yang, the pain over here is Sao Yang. Okay, so Sao Yang and Tai Yang, and this is Sao Yang meridian and Tai Yang meridian, which means if you have pain over here, back in the bottom or over here, you can use here those two meridians to get the acupressure point, pressure that, and relieve the pain over here. Okay, because the family meridian can help each other, can balance each other. So what happens now, if the pain is not on the meridian, it's between the meridian. Okay, between the meridian, and we find a point at between the meridian. So for you, it's easy. This is a theory. That's how it link together. Okay, for you, it's easy. Very, very easy. You just need to know the pain is on the side, on the back. Okay, so I'm going to show you some acupressure. Only work for here and here. No acupressure point for the groin today. Okay, next time we'll do acupressure point for the groin. All right. So whatever you feel the pain in the hip, you go acupressure point in the back of your shoulder, from the top going down here. And how do you do that? You can use your fingers, your thumb, or your knuckle. Or even if this person is very strong, it's difficult to do it yourself. Some people you can, I can do it myself, right? Using here, using my hand. If that person is very strong, you can use your elbow, okay? Or massage device, okay? Or knuckle, alright? This is your tool, this is your tool. Using thumb, you may get joint pain, okay? So, go to the back, press it. Use the same pressure, press it, and up and press. Look for the most sensitive point. You may get the most sensitive point. When you hit the most sensitive point, you apply two techniques. Okay, all my video I only teach two techniques. Okay, no more than two techniques. This technique is easy. The first technique, when you hit the point, when you get to the most sensitive one, how do you get to the most sensitive one? You press it, press it, press it, press it, press it. You will find. Use the same pressure for all the points along here. Once you get to the most sensitive one, you press your fingers in there, or your device in here. Press it, hold it for 1 or 2 minutes. You will find the pain, the tenderness spot, release, gradually relieve. Maybe 1 minute, maybe just 30 seconds, or it may up to 2 minutes. when you can't feel the pain or tenderness there, slowly release your fingers. Slowly release the pressure. Okay? Then you can go again, and the second time you move your hip. While you press it, move the hip. Okay? When you move the sore area, and it will work even better. You'll find, whoa, the pain relief, right? Instantly. The second technique is when you hit the most sensitive point, you get into it. Like if this is the sensitive point, okay, you press, the same pressure. The first time you press, okay, nothing, you can't feel anything. Second time you press harder. When you hit to the point, you press on it and you rub it. Okay, in this technique, you need to understand, you need to prevent that you rub it on the skin. If you rub it like this, it doesn't work, and you may hurt your skin. Okay, so you're gonna press it. You get the most sensitive, you press it, and you rub it like that. You see? You don't rub it on the skin. You put pressure on it, hold the pressure, and rub it. Okay, or massage device, hold it and press it. Okay, so while you press, it maybe press it for 60 times. Count to 60, and then start to move your hip. Okay, and then it'll give you relief. Now, I want to point out this. There may be some more point. If you see, if I press the most sensitive point here and I get to the point and the pain in your hip still there, you can get to the next sensitive point. So it can be an area, okay? When we're talking about acupressure point, but the pain may be in your hips, not in one point. It's an area. It's a whole area. When a whole area, you need to find the most sensitive one, then hit. After the first most sensitive point, you hit to the second sensitive point, third sensitive point, fourth sensitive point. Okay, hit to those points, cover all those points, give it some massage and acupressure. Then it should help. It should help. Okay, so remember, it's over here, from here down to here, which is in here. This is your shoulder, the top of the shoulder, and the back going down. Alright, so if the pain in this area move down, you're gonna move down to your knee, move down to your elbow. If the pain, you locate the joint, the pain go up, then you go up to here. Alright, so this is very simple. Very simple. Then you can do it yourself. Okay, so whether it's chronic hip pain, acute hip pain, an injury, spot injury, very common. Okay, you all can apply this technique on it. Okay, because you're not doing acupressure point or massage in this area, so it won't bring you any harm. Alright, by saying that is because it's a fresh injury. If you massage in here, it may cause more pain. Okay, you need to apply ice first. Okay, you need to apply ice first. Okay, by doing distal point, it doesn't matter whether it's a fresh injury, a chronic pain, or acute pain. You all can apply the distal acupressure point. So I suggest when you do this, you treat the opposite side. Do the opposite side first. If the opposite side works very well, keep going with that. If the opposite side doesn't work so well, then do the same side. Okay, if the pain isn't here, you do the same side. You do the opposite side first. If it works well, keep going with that. If it doesn't work well, then you have to go cut. You can choose the same side. And alternatively, acupressure point for pain relief. Okay, this is only for symptom relief. symptom relief. If you want to treat the root of the problem, you need to look at, you need to find the acupuncture to treat the organs. Why is that? Because we find through acupuncture, if you just treat the symptom, depending whether you want to just relieve pain, relieve symptom. If you want to relieve symptom, this is very good. It's better than painkiller, to be honest, because painkiller go in and will harm your organs. But if you want to correct the root of the problem, you need to see an acupuncturist. Why is that? You may find that when you do the acupressure point, it works, okay, but it keeps coming back. The symptom keep coming back, or it get better to some point. It can't get any further. When it can't get any further, which means you may have an organs imbalance. Why do I say that? If there is a muscle problem, let's see, you can't see it properly in this chart. I'm going to make it that you can see properly, if I know how to do that. Okay, now I'm pretty sure you can see it properly now, right? If any of you can you see this chart? Can you read stomach and spleen? If you can read it, can you give me a thumbs up? Any of you can read this? Because if I turn it this side, you can't read, and that can read it. I'm pretty sure, right? Can you read it? Can you see it properly? Great, thank you for your answer. You can, that's good. Great, thank you for giving me the laugh. Yes. Okay, leave it that. Okay, great. Thank you. Now you see spleen and stomach, right? Oops, not that one. If I stand up in here, so spleen and stomach, they control muscle strength. Okay. The acupressure that I show you today, it will give you symptom relief, for sure. But to get rid of it, to treat the root, you get relief, but at some point, you can't get any further. Okay, that is because stomach and spleen weak, the muscle hasn't got much strength. So we need to treat the organs. So treat the organs is important. And sometimes it's not because of stomach and spleen issues. If you have stomach and spleen problem, you may suffer bowel motion issues. Okay, the bowel motion issue is you may get constipation or lose bowel motion, and type 2 and 3 and 4 is normal. Okay, or you may experience as well as bloating or stomach pain. Okay, then that is quite sure that you have a stomach and spleen digestion problem. Then in this case, you need to find an acupuncturist or Chinese herbalist, okay, to treat your organs, to bring the stomach and spleen organ back to normal. Then your muscle strength will build up. Okay, so build up the muscle strength is not just exercise. Okay, build up the muscle strength in Chinese medicine. We need to treat the organs, get the organs balanced. Okay, over here, if there's a bone issues, if that's related to bone, is the pain. If the pain is very deep, that may relate it to the joint or bone or tendons. Okay, look at that. Kidney and bladder function according to Chinese medicines. It actually, kidney and bladder control bone strength. Okay, liver and gallbladder control tendons, joint, and nerve strength. So if those two out of balance, this won't have enough strength to heal. So in acupuncture, in Chinese medicine, we use acupressure point to relieve the symptom as well as treating the root of the problem. So when we correct the organs, we balance the organs, the joint. This is here, the joint, the bone, the muscle around it, and the tendons. You see the tendon ligament, the strength will increase and it will heal itself. It will heal itself. We don't put drugs in the needles. You're pressing the acupressure point. It doesn't contain any drugs in it. How do you get relief from it? It's because by pressing this point, by increase the blood flow in the organs, balance the organs, you increase the blood flow and the energy into the joint itself, help it heal. So some patients, you may feel it. You put a heat pack on the chronic pain area, you feel relief. That's because it bring blood flow into the joint, and then you feel better, you feel relief. So with chronic pain, I use acupressure instead of drugs for label. That's good. Yeah, fantastic. Yeah, we do a lot of treatment for fertility patients. So have a look on here. We have picture on the wall that we got those patient. One of our have a look. We have some picture in here, baby photo. We do a lot of fertility treatment for our patients. Okay, we treat pregnancy, back pain, hip pain, all sort of pain as well. So we help those patients to get pregnant, to stay pregnant, prevent miscarriage. Then we help them go to labor. How do we help them go to labor? I might have to do another video to explain how I do that. We actually show them how to show their partner, because in New Zealand and Hamilton, when you go for labor, either you go to hospital, birth center, or home birth, right? So you got your partner beside you. So we teach partner how to locate some acupressure point, how to use the technique to help the wife go to labor, reduce the pain, and shorten the labor. Okay, and without any drugs, okay, and it's fantastic. Okay, fantastic idea and program for all my patients. Now, if you know anyone who, that's awesome. That's right. Yes, that's awesome. If you know anyone need this treatment or need to know about the knowledge, invite them to our page, okay, or come to our clinic. Okay, we're happy to show them. And I'm planning to film a video about this and how to release, use some acupressure point to relieve pain to help them go through labor. Okay, and this is fantastic thing, and we've been helping a lot of people in the last 12 years. Okay, back to hip pain, all right? Back to the organs. So treating the organs is the most important thing. Okay, acupressure point work very, very well for pain relief, but that's not good enough for some patients. Okay, some of you, if you look at this video, if this help you, fantastic, keep using it. And if it can get rid of the pain completely in the end of the day, that's good, keep going. And if you find it can't go any further, or the pain start to get worse, only when you do it you feel better, but when it comes still quite bad or even worse, okay, or it go to some level, you just can't get it to even further. At this point, hey, you really need an expert, an acupuncturist or Chinese herbalist to look at the organs imbalance. Okay, now if you live in Hamilton and we're in Dinsdale, you're welcome to come to our clinic. Okay, our phone number is 07846 7956. Okay, give us a call, give us a Alicia or receptionist a call, and we actually offer a 15-minute free pre-assessment. You can come to talk for up to 15 minutes, no charge, to see how we can help you. There's a way really there is any organs imbalance according to this charge. Okay, organs imbalance. Okay, then from there we'll be able to tell you, hey, you do have this imbalance, and I think if you do for acupressure point, keep going with that, but on top of that you need some Chinese herb to bring your organs better, and then you'll be able to get to your pain down to even minimize the pain. You see what I mean? Okay. Someone said, sorry, I can't Tertailu. I'm not very good to pronounce your name, I'm so sorry, but I can pronounce your last name, Robert. You see, I used to come to you after my car accident, and acupuncture was the only thing that happened will relieve my pain. But then I moved to Rotorua. Oh, great! Thank you for telling me that. That's awesome. You're awesome. Hey, there are acupuncturists in Rotorua. Okay, I'm pretty sure. Go to a website. Let me check the website. And our association. Because we call ACNZ now. Let me Google it for you. ACNZ. The website is still there. Let me search our association for you, because you can get the acupuncturist in Rotorua too. Let's see. Yeah, this is the link called Acupuncture NZ. If you Google Acupuncture NZ, you get to the link called acupuncture.o.nz. Okay, acupuncture.o.nz. This is our association, so which means it's been certified acupuncture. We all join this community, okay, this association, and in this website you can find out there is a button on the top. We call it navigation, right? Find a practitioner. So you can find a practitioner according to the city that you live with. Okay, so find a practitioner that live around you and go to those practitioners. Okay, Rotorua, I'm pretty sure Rotorua have a lot of colleagues in there. Okay, but I'm not quite sure which one will suit you better. Okay, you just have to go and find and read their website and try it out. Okay, so this is about heat pain for acupressure point. Then next time we're gonna talk about some groin pain. Okay, next Friday we're gonna talk about acupressure point for groin pain. And every Friday I'm gonna do live video here to teach you how to use acupressure point to relieve pain, any kind of pain. If you have any topic that you want me to talk about, can you please put a comment and tell me, let me know, and I will arrange that for you. Okay, thank you and have a good day. Bye bye.